same level.
I think this one's supposed to be here.
So look at this. It's all over the floor. Janae, really, Janae? That's where that goes?
Really?
No, just move. Just move, Janae. Just move.
What's wrong with that?
What is good for hands? Sis?
Oh gosh, I've had it. I can't take it anymore. All these new nurses.
I swear, where did they even go to school at?
Okay, so you put this one over here and this one right there. Okay.
Yeah.
So the
Obviously, that's where I
Yes.
put it, isn't it?
Yes.
Okay.
That's where it goes.
Ladies, gotta get some towels to clean this up. What's going on?
Well, I'm trying to hang the IV bags, but nothing seems to
Do you see this mess?
She
It
had.
was an
okay.
accident. I didn't mean to.
They were the same level.
It's okay. Did you explain to Janae why it had to be different?
No.
We just assumed
I
she
showed
should
her.
know that.
What would be the best thing to do for the patient and for your coworker? I reckon we're gonna handle it differently.
All right, ladies, I'd like to see all three of y'all in my office, please.
Shauna, Jessica, y'all been here for a while. You should both know that we have a zero tolerance policy on bullying. Are you aware of that? Did you sign the paper when you were hired?
I guess so. It's the only reason we're getting paid.
Yes, ma'am. Jessica,
Yes, ma'am.
I want you to explain what that means. What does it mean when we talk about bullying and the zero tolerance policy?
I think it means we're not supposed to talk ugly to people.
But why?
Might hurt their feelings. Janae, did we hurt your
And it
feelings?
probably also affects her work performance, I guess.
Would you want to work in an environment where you feel like you're being bullied or people are not helping you and you're a brand new nurse? Do you remember how it was when you were right out of school?
Yeah, and I suppose the patient wouldn't want to be here either. That was really inappropriate to do that in the
Very
patient's room.
inappropriate. What we're gonna do is, Jessica and Shauna, you'll be attending a class, a remediation class. And I think it'll be best because I think you need to learn best practices, how to interact with your coworkers and your peers. Do you have anything you want to say to Janae?
Sorry, Janae.
We're really sorry.
Thank you.
We'll try to
What
be
could
more
you have done
helpful.
better when you walked by the room and saw Janae was having difficulties with her IV?
We could have just explained it to her a little better
And help her.
and helped her, and Shauna wouldn't have pushed her.
Sorry I pushed you, Janae.
Janae, do you have anything you want to say?
I just think that sometimes I need a little extra help. So I wouldn't mind if I had like a preceptor to help me along the way sometimes.
Okay, I think we can do that. You're still out of school, you've not been out of orientation very long, we can get someone to help you on the floor. And girls, I want you guys to be better role models for the new nurses coming on the floor,
We will.
okay? All right, thank you. You can go back to the floor.
Thank you.
Thank you.
According to the ANA, lateral balance refers to acts perpetuated by one in a higher level of authority. These acts may be verbal, nonverbal, however, they are all acts of aggression. Acts such as gossiping, withholding information, and ostracism.
48% of nurses, farms, and others report strong verbal abuse. 43% of nurses, farms, and others report experiencing threatening body language from coworkers. 53% of student nurses polled reported being put down by a staff nurse, and 56.9% reported being threatened or experiencing verbal abuse at work.
40% of nurses polled reported that they've kept quiet about improper medication administration due to intimidation by their peers. Unmanaged anger leads to hypertension, coronary artery disease, depression, and psychological problems and other healthcare issues. Low morale, increased absenteeism, staffing shortage, and poor patient care are associated with lateral violence. Many new nurses leave the profession due to lateral violence, and this increases the nursing shortage.
Several things have been put in place to address this epidemic in reference to nursing bullying at the workplace, such things as zero tolerance policies, protection from retribution, employee assistance programs, interrupt the violence as it is happening, assess the units and raise awareness, encourage dialogue, create unit-specific guidelines. This information and much more is located on the ANA website at www.nursingworld.org.
Zero tolerance!